Hi, and thank you for attending. My name is Melody Tash, and I'm currently a student at Columbia College in their speech-language pathology program. And today I'm going to introduce you to one of the major racial disparities that's plaguing this field. I've spent the last year covering this topic and taking multiple classes that have helped to deepen my understanding of this issue and its implications, to develop a sustainable solution, and how to look at this issue through the lens of a healthcare communication ideal. Today I'm going to be talking about the basis of this issue, the solution that I have developed, and the benefits that will come about from taking specific action. Have you ever known anybody that has trouble with their speech or has issues with communicating with others? Have any of them been children? Statistically, it's likely based on a 2012 National Health Interview Survey that showed that 1 out of every 12 children in the United States is diagnosed with a communication problem. That means on average, 6.2 million children in the United States have trouble telling others about their needs. But within these numbers, there is a serious distribution difference between race, diagnosing, and treatment. The same 2012 National Health Interview Survey showed that 9.6% of Black children were diagnosed with communication problems, 1% less of white children were diagnosed, and 2% less of Hispanic children were diagnosed. Despite these numbers, 60% of white children received treatment, while Black and Hispanic children were 20% less likely to receive the same treatment. This data shows that there is a serious misalignment between the diagnosing and the treating of minority populations. But what has created such a drastic divide? Doctors. Doctors are the leading cause of Black and Hispanic children's lack of access to speech therapy services. But by educating and advocating at the local and national levels, we can help remedy this disparity and serve the people that need it most. First, let us explore how the professionals that are supposed to keep the public healthy are actually standing in the way of minority children's speech and language development. Doctors are required to monitor the development of their patients through various methods, but they fall short when it comes to the treatment of minority populations in terms of speech and language development. Doctors give untimely advice and ask minority parents less about their child's development than white parents. A study presented at the 2012 American Speech, Language, and Hearing Association's annual conference showed that the #1 barrier reported by minority parents to accessing speech therapy was untimely and inadequate advice from doctors. An article released by Andalusia Speech Therapy in 2020 showed that doctors ask minority parents less about their children's development than white parents. And when concerns are raised by minority parents, doctors adopt the wait-and-see approach. And in 2017, Brooke Andrews, owner of the Speech Dynamic, stated in her article, "What's Wrong with the Wait and See?" that the most critical time for early intervention is before the age of 5 because the brain is the most malleable and able to change. Shannon Briggs wrote in an article in 2019, published by the SLP Corner, showing that the wait-and-see approach is counterintuitive because most late talkers do not developmentally catch up to their peers on their own. So not only does this approach bypass the most critical developmental period of the brain, but it's ineffective because most late talkers need speech intervention anyway. The best way of addressing the inadequate actions of doctors is to educate on and to advocate the importance of early speech intervention and about resources for speech therapy. By working both at the national and local levels, we can help increase awareness of the benefits of early intervention and available speech therapy services for Black and Hispanic children. Annual national conferences from organizations like the American Academy of Pediatrics and the National Association of Pediatric Nurses need to feature professionals of the speech-language pathology field that can emphasize the importance of early intervention and some of the basic speech and language developmental milestones and red flags. A seminar like this would highlight how the wait-and-see approach bypasses the period where children's brains are the most pliable and open to change, how early intervention allows children to more easily close the gap between them and their peers, and would provide materials and resources for healthcare professionals to bring back to their own offices and raise awareness. By taking a national approach, greater change can be made across the country, and broader education and advocacy efforts are more likely to reach the people that need it most. At the local level, volunteers and contributors would network within their area to pediatricians and family doctors, especially those working with these minority populations, to not only educate staff, but to provide a more open and inclusive environment for these populations through the same materials and resources used at the national level that feature real-life models and wording that specifically highlight and represent them. And by taking the local approach, Black and Hispanic children that need intervention will be the main focus of efforts, allowing for specific and articulated efforts to bring about the most monumental change in these communities. The best and honestly only effective way of treating this racial disparity is to raise awareness and educate others at both the local and national levels to create the strongest wave of change. I'm going to ask you to close your eyes for a moment. Imagine that you are a member of these minority populations going to the doctor's office because you know that something is different with the way that your child communicates than their peers. But you are wary because other doctors in the past have written off your concerns and invalidated your feelings. Visualize that you're walking into a doctor's office with a pit in your stomach and an unshakable sense of dread. But this time you're confronted with posters and flyers of models representing your ethnicity and that highlight beneficial information about speech and language development. And imagine that when you meet your doctor, they directly ask about your child's speech and language development and address your concerns with attention and compassion. You may open your eyes. Wouldn't you feel heard and that the health and development of your child is the #1 priority in this office? Now imagine that each doctor that attended one of those national conferences brought back their experience or brought back their increased knowledge and this type of environment to their own offices so that minority populations are helped everywhere across the United States. I want to round out this moment by talking about what we can do as individuals and as part of a community. We've seen that Black and Hispanic children are diagnosed more often, and yet despite this, receive considerably less treatment. And we've seen that doctors are the root cause of this, the ones that are uneducated on speech and language milestones, and the ones that just don't ask minority families about their child's development. We've also seen that the solution to this problem is to advocate and educate at the national and local levels, emphasizing the detriments of the wait-and-see approach and the benefits of early intervention and common speech and language developmental milestones. We've also seen the benefits that this approach will bring about at these levels. And now you may ask, what can I do to help? As individuals, we need to raise our own awareness to this issue so that we can see in our own lives when Black and Hispanic children are being blocked to accessing speech and therapy services. And as a community, we all need to strive to educate, advocate, and work together towards a better future. So go forth and remember to advocate and educate for the speech and language development of those around you. Thank you, and I appreciate your time.